I want a beauty that will give me that glow. The kind of body that'll make them say, whoa. Get it right with the night who slays. Beauty and the blade. Yeah. Get it right with the night who slays. Beauty and the blade. Get it right with the night who slays. Face and body.
Well, good morning, everybody. I am Ashley, and this is my husband, Dr. Park. We are Beauty and the Blade on Go Country 105. We just want to have a discussion this week on, what do you want to talk about this week?
Well, let's talk a little bit about recovery. It's such a common question. So what we thought we would do in this episode is go over pretty much all of the surgeries that are pretty popular and get a recovery instruction and perspective, like stuff that you may have gone through and what we think we need to help the caregivers as well.
Yeah, so talking about recovery, of course, just like Dr. Park mentioned, we are going to talk about the most common and popular surgeries that we do in our surgery center. If we were to go through all of them, we would be here all day and all night.
All night.
So let's talk about, what is the first one? What's a common surgery that we do at our practice?
So I would say I'm pretty an expert in breast surgery overall.
Right.
So just a little bit of history, started off doing a lot of breast cancer reconstruction.
Mm-hmm.
That has then developed my practice into breast revisional surgery, complicated breast surgeries, and just breast augmentation and lifts and reductions.
Right. Well, let's talk about the easiest recovery out of all of those that you just mentioned, because you can have a patient that is getting an implant with a lift and all that, so it goes into. So let's talk about the
Right. So a common misconception, I'll talk about one of the biggest surgeries, is a reduction or a lift.
Right.
Right. So we're talking about a low ptotic breast, and I have to kind of recreate it and lift it. The interesting thing, I'll do a breast reduction, and some of those patients will be pain-free in 1 or 2 days. So what's interesting about pain in this surgery is it's very little because I'm not touching muscle.
Right.
So one important aspect, if you think about any surgery, is the deeper you go, muscle hurts.
Right.
So when we lift the muscle and place an implant, that's sore. If I'm doing a tummy tuck muscle plication, that's sore. And one of the most sorest is working on bone. If you've ever had back or bone surgery, that hurts.
It makes my whole body crunch.
Me too.
But how you were explaining about just doing the skin, I have had patients that just say, I have this burning sensation.
Mm-hmm.
Is that the common when you're just removing skin? It's like a burning.
Burning is a very common in recovery. What's healing in that sense is the nerves, as you know.
Right.
So anytime you are experiencing burning or tingling or weird sensations, that is your nerves that are slowly trickling back.
Right.
And nerves can take sometimes 1 to 2 years to regenerate. So it's not uncommon. 6 months, I'm seeing them for a checkup, and they say, I feel a little once in a while a shocky pain. Those will resolve, but nerves are the slowest things in the body to heal.
So with a lift and reduction, I'm part of this surgery too.
You've done a lift before, so.
I can do it with my eyes closed.
You can.
No. But when you are performing this surgery, doing a lift and a recon, you're removing also tissue.
Correct.
So do they have a different sensation from removing tissue alongside with the skin?
It's interesting that you mentioned that, because you see me when I mark the patients and I'm marking this T-wise pattern. It's pretty complicated on the skin to do a lift. And when I make all those incisions, a lot of them don't complain about the incisional pain, especially if I'm doing a lift with an implant.
Okay.
As you may have experienced, I'd like to know how you felt with an implant surgery placed under the muscle can be painful. What do you think?
No, I think that was worse than the lift.
For sure.
I've mentioned this in our previous show. So I had a friend that had breast implants this is years ago, probably a month before me. And we were going to different surgeons. Mm-hmm. And this is obviously before I knew you.
You didn't come to the best.
So she went to her surgery. I picked her up from there, and we went to a nightclub that night. after her surgery. She had it in front of the muscle.
That's what I was going to ask.
So I feel that then when I went in for my surgery, I was expecting like, oh, I'm going to be good.
going to
and
the
it was right
club.
around Christmas
Yeah.
too. And so I was like, oh, I'll be fine. Oh no. I
Sore.
felt like super sore. A lot of patients say, oh, it feels like an elephant or a train's on my chest. You do feel like that. I grew up swimming. So in swimming, when you're like doing all these strokes and you're in a tournament, you know, and then you get to the end, like you feel like your chest is just like,
Pressure,
you know,
yeah.
yeah. So it's that pressure. It's the
Right.
pressure. Is it intolerable? No.
So explain the big difference. It's because your implants
Were
were
behind the muscle and hers were in front of the muscle.
big difference. So just explain a little history on that. About 20 years ago, we were placing Mohs surgeons over the muscle. Part of the reason was exactly what you mentioned, is that it's a very quick recovery. If we don't touch muscle, we go over it, you're going to the club the next day. I mean, it's
Yeah.
pretty quick.
No, it's crazy.
However, why do we now and why do I go under the muscle is because if you go under the muscle, you have better coverage.
Right.
You have a lower incidence of what's called capsular contracture. And what that is when the implant gets a hard shell of scar tissue around it. So under the muscle, let's think about this. If it's under the muscle's moving and it's kind of massaging the implant as you're moving your
Right.
chest and arms. If they're over the muscle, it just sits there, and that scar tissue can be as high as 30%. So that's a complication that we don't want.
What about the rupture rate? Would, you know, your implant be more likely to get a rupture if it's in front of the muscle? Or
I'm
does
not-
that really?
Correct. I don't think too much about the placement, but a big rupture difference is between saline and silicone. So a saline implant can ripple and actually has a valve in it that we actually fill it up with, and those can leak at those
Right.
points. Now silicone has a lower incidence of rupture because we don't have a valve and rippling as much.
Yeah.
So
So, and then going back to, so yes, having the breast implant was a lot more painful than
How
the
long?
lift. You know, this is so, when you were talking
Couple
about,
days.
20 years ago, we used to put them in front of the muscle. I was like, I think my surgery was more than 20 years ago.
yeah, it's
But
also doctor dependent.
yeah. I don't know how long my pain, I just remember I remember it being around Christmas and all my family coming over, and I didn't want to tell my family at first.
Yeah.
And then, so I just wore baggy shirts,
And
and
you're like,
then it was, yeah. And I remember going to, I don't know, some store, Walmart, Target, Kmart, something like that, with my grandmother. And she's like, here, like grabbing a case of water.
You
and I
couldn't
remember
do
my
that.
doctor saying, don't lift over 5
Don't do
pounds.
that
Yeah.
at all.
And I was like, and I just broke down crying. I have to tell you something, you know.
So-
So I think it was like about 2 weeks for me.
So most patients, your pain tolerance is a little different.
Yeah,
My
I'm the
wife
world's
is a
biggest
little bit
baby.
slower to heal. I would say most of my patients follow this. They're off pain meds in about 3 days on average. They're able to drive by 1 week. That's a very, very good average.
Right.
And the most common question is, when can I go back to the gym and work out? And for my breastplate patients, I usually have them begin working out at about 4 weeks so that we don't injure anything at
Is
that time.
that for all procedures or just for the
This
breast?
is specifically for breast.
Okay.
So I'm a little bit quicker. If when we go into tummy tucks, we're going to slow that down even more because that's your core
Right.
movement there. But breasts, again, a lot of the times I'm operating on Mondays or Wednesdays. They'll do a Wednesday surgery and they're back in the office on Monday.
Okay.
5 days, pretty quick.
No,
Just-
that's what I've
yeah,
seen
on
with other
average,
patients.
I
Like
would say.
I totally, I'm just seriously, like, you guys have to know, like, I am the world's biggest baby.
You're a cute baby.
And I
though.
want to just like,
Yeah.
oh, sorry, I can't vacuum.
And I can't either. However, the other important point, which is very different from years ago, is we usually used to bandage people up and
Right.
people wouldn't move for like 2, 3, 4 weeks. The number one secret to decrease your pain in a breast surgery under the muscle is stretching and moving.
Right, getting that range of motion
The
going.
range of
yeah.
motion. People don't want to do it, but that's the number one thing I tell them is as soon as you get home, you want to stretch the pec
Yeah.
as if you had done 500 push-ups. It's very important, and people
Ouch.
don't understand. They don't want to do it. So usually, let's talk about this. We usually talk about the caregiver. And
Right.
so I tell the ride, I said, when you get home, be sure to slowly stretch her shoulders back
Right.
to relax the pec muscle.
Yeah, and I think that's very important to have that other person that
Absolutely.
is like all the rules, they're on them,
Yeah.
you know, and they're just going to make sure you're following up with that.
Yeah.
You know.
So I think in the pre-op, it's very important that we do tell the caregivers that, you know, you need someone at least for about 24, 48 hours to really kind of help you
Right.
with even like getting up and down,
Well, I feel that when we get into more of a, you know,
like a
like
tummy.
a tummy, yeah. And lipo too, when they're having in their lower extremities, they do need a little bit more
A little
help.
bit of assistance.
Yeah.
It's super important. I
Getting
would
up
say
and getting down and
getting up and getting down. But I would say also, as we get into a lot of my patients are mothers that have young kids, you need help
Yeah.
with the kids, right? Just even keeping them busy, and so they're not
Right.
saying, "Mommy, mommy, mommy,
Yeah.
mommy." I mean,
because
ours do
as
that
a
all the
mom, like
time.
all of us women, we try to plan it on a holiday week or spring break
Mm-hmm.
and when the kids are at home. But I personally think it's easier when they're going to school. And you
point.
have still somebody at home with you, but you have that arrangement of somebody's taking them to school, picking them up. So you
Right.
don't even have to think about all that. All you have to think about is your recovery.
Yeah, I think that's so important as a mom because if the kids are at home, I mean, wouldn't that be stressful for your
I
recovery?
feel that it is because you just are constantly,
Yeah.
I don't know about everybody else, but for myself, my kids, like my husband always says they're my little ducklings because I will leave a room and even my 17-year-old just follows me. They follow
Right.
me around, you know. So
Where's mom?
if I am laid up in bed, if I'm sick or surgery or whichever, they want to lay right next to me.
They do.
Which I love
And I'm
because I
like,
don't know how long that's going to last.
Daddy's over here.
Yeah.
Can I help? They're like, no,
Yeah.
where's mom? Where's mom? You're like laid up trying to, where's mom? Where's mom?
But you know what? I'm getting you more involved of like, oh, well, you know what? Ask your dad about that. Your
True.
dad's going to be in
You
charge of
almost
that.
have to force them over to me.
Yeah.
They love kids, you know, they just have this inherent love for mom, so.
So I want to break this up a little bit. We were talking about breast and a little bit about liposuction and tummy tuck. What about recovery for the upper?
Yeah,
Body.
before we get into that, we're going to leave the breast, but there is a myth buster. If you want to read us that.
Okay, so Mythbuster. Plastic surgery lasts forever. Does it last forever? No. Just like how there's another one where patients seem to think that after they have breast implants, oh, it's been 10 years, I need to replace these bad boys.
Right,
Yeah. No, you don't need to do that either.
I agree.
Yeah.
Yeah, so I think the reason why, again, that was an old kind of teaching that was passed on and on, was we often saw saline implants deflate after 10 years. So that's one reason. Also, we weren't sure about the durability of the silicone implants. So I'm really of the adage, if it ain't broke, don't fix it.
Right.
So if a patient comes to me and she's had 25-year-old implants, if they're soft, no symptoms, and they're happy, there's really no urgency to replace the implants.
Right. So that's with breast implants, but just asking in general, plastic surgery lasts forever. We all age. There's no, they have not came out with it yet, of a pill that we're just going to freeze, you know? So we all are going to suffer age, pollution, gravity.
sun
So we have all
damage.
this against us.
Right.
So no.
So speaking of the face and aging, so let's talk a little bit about the recovery of the face.
Okay.
Peels and lasers, something common that I do. Generally, if I'm doing the heavier types of lasers, they will peel for about a week. But if I jump to the conclusion, anything I do in the face generally heals very quickly in about a week. Upper lids, facelift, neck lift, generally sutures are out in 1 week.
Do you tell your patients like, well, if you, for instance, you take arnica at home, more protein, like is there anything else that you suggest to them for post-recovery?
That's a really good topic of discussion. I think what is important, people ask, is there a special diet or nutrition? Generally speaking, I think it's stay with a healthy diet. We do encourage lots of protein. Protein we know for wound healing. There are 3 vitamins I like patients to take in healing. That would be vitamins C and zinc and a multivitamin. We know those are very important for wound healing.
Yeah.
Yeah.
I like that.
Yeah. And hydration.
Yes. So that's with laser and other surgeries.
And facial.
What about upper and lower eyes?
Yeah, so all of those generally, I call it more of a cosmetic, kind of a celebrity hideout type of surgery where you're recovering. So these types of surgeries, anywhere in the face is relatively painless.
Okay.
So I'm talking like they take a pain pill for 1 day, maybe 2 at most. It's very uncommon they have pain after a day. It's more of a tight feeling, but they do swell. So lots of ice is important in the eyes for about 3 days. Keeping the head elevated for gravity to swell down, and finally ice baby, right? We talked about ice, and no salt in the diet.
Right. So that would just typically go for all, a full facelift,
Facial.
eyes, all of that.
Correct.
So let's get into tummy tuck.
Oh, ouch.
That's a longer recovery, right?
A little bit longer.
How long do you typically tell your patients that they'll be down?
So I try to give them things that they can remember. So for example, with a tummy tuck, I talk about a 2-4-6 week rule. So in general, at about 2 weeks, you can do light driving, maybe a light errand. You're still going to be very tired. 4 weeks, I let you walk around and do maybe like quarter mile, a little bit more energy coming back.
Okay.
6 weeks is the full release, hit the gym, slowly get into lifting all of it.
Yeah.
That's kind of the
And I
general
would say what you're explaining, that kind of goes with liposuction, BBLs. I feel that with BBLs, the only difference is there's different, devices that you can purchase, like I think they were called a butt pillow.
Yeah.
But so you don't want to be directly sitting on the tush.
Correct.
Yeah, you want to kind of take that weight off of there, let that swelling go down, let everything fall into place.
Right. So no pressure on that for fat transfer for about 3 to 4 weeks on average.
Right.
Yeah.
All right.
But a little bit more pain, I would say. I would say our friends that have undergone abdominoplasty procedures.
No, I would say that's the most painful procedure.
Yeah.
Yeah.
So I would say pain lingers for more 5 to 7 days for pain medication. Again, that's on
Well,
average.
if you're asking for my personal opinion.
You a little bit longer.
Yeah. It was just, it was hard you would make me get up and walk around. And I was like, I don't want to get up. Because you kind of, but I'm a nurse and I know that range of motion is very important.
Right.
Because even when we're talking about doing the upper body, the breast, after you have the procedure, you kind of want to stay like this. You don't want to move. And I know, like for myself, and I've seen patients too, they put all these pillows under their arms and they're just like this. So when you go to finally move, you're like, oh,
Right.
And with the tummy, when we're laid out and, I had this amazing recliner that kind of like squished me together.
I could not sleep in that, but yeah.
It would even help me stand right up. So when I had no help,
I remember.
because I was one of those that I did not plan ahead, where I'm like, oh yeah, I'll need help. I thought I would do it all on my own. But you get stuck in that position that once you finally move, it's so hard. But if you're doing that right off the bat,
Exactly.
it's it's going to be a lot easier.
So I'm just going to hone in on that, double down on that point again. Movement is so key after surgery. Even if you have major surgery in the hospital, what do they tell you to do? Get up and walk around and do
Yeah.
laps on the floor, because that's what's going to rejuvenate your energy, and you don't want to get stuck. The other most important complication that is talked about in tummy tucks is what's called a DVT
Right.
or a PE. Those are initials for clots in the legs or clots in the lungs that can inhibit breathing. Very, very serious. So the only way to, a major way to prevent that is you've got to walk so that the blood does not pool and stay in the calves. So again, I tell my patients, day one in a tummy tuck, you are walking every 2 hours, laps around the house.
How would a patient even know that they're starting to have a DVT or?
Correct. Good question. Something to look for, very serious in the tummy tucks, is the clots in the leg will produce swelling and pain or tenderness in the calf. So if someone says, hey, I've got some swelling or my calf pain, then immediately we're going to send them to get an ultrasound of the calves and make sure that we rule out any clots. Yeah.
Well, is there any other procedure that we haven't covered, a popular procedure that we do in our practice?
The last one that I see kind of on our list is rhinoplasty.
Oh, yeah, we
Yeah.
did miss that one.
Yeah, that one's kind of a mixed bag, if you will. But once again, I wouldn't say that it's terribly painful.
No,
What do
not
your
at
friends
all.
say? Not at all.
No, I feel like that was like a smooth recovery. Everybody says that.
Right.
It's just you feel, because you
Congested.
just had that procedure done, you're very cautious of how quick somebody is coming at you
you're like,
or
"Ah."
coming in to give you a hug. You're like, hold on, because you're just scared that it's gonna
Yeah.
hurt, because as we all know, the tip of your nose is almost the most sensitive
Right.
part of your body.
Yeah.
So it just gets a little.
Yeah, you do get aware. Did you feel congested? Is that one of them?
Yeah, I felt congested, but it wasn't as bad as I was imagining that I was
Right.
going to feel like. I thought I was going to have a lot of congestion, maybe coughing up some fluid, any of that, but I didn't experience any
Not
of
too
that.
bad.
And I feel like there's a mix of patients that say, yes, I felt very congested. I was
Right.
congested up to 6 months.
Yeah.
Some don't experience that whatsoever.
You must have had a great surgeon. Finally, when did you feel that with a rhinoplasty so I generally have my patients have the splint on for about 5 to 7 days.
Right.
Then it's off, little bruising, makeup, no problem. When did you feel you could comfortable to go out into public after
I
a
went back to
rhinoplasty?
work. I think it was 5 days after
Whoa,
my
quick.
rhino.
That's pretty quick.
Actually, no, it was 6 days. It was 6 days after. I remember on the 5th day at home, you took off the splint.
Right.
And let me tell you, I was looking in the mirror and I was like, ah.
It's like glorious.
Yeah.
The angels
And
came.
I bruised pretty bad.
Yeah,
I had
I
2
remember.
black eyes. But just to see like no wide nose and no hump in my nose, I was like, I was born to be like this.
Yeah, you were born this way. You know
Yeah.
what's interesting is I would say your description and the rhinoplasty patients when the splint comes off is one of the most rewarding, and just, people are just so happy.
No, I couldn't
to
stop
see the
looking at
change.
myself.
Yeah, and still to this day.
Oh, please. But, well, yeah, no, I do. Everybody does mention about my nose, especially
You look
people that have
beautiful.
known me for years. They're like, oh, your nose looks so great. I actually have 2 friends that are coming in to have their nose done.
And there you go. You're
Yeah.
like a model of face
I'm
and
your
body.
walking billboard.
You're an angel. Let's just jump into a little humor, and I wanted to know if something super funny happened to you during this week or past few days.
Oh my gosh, you know what? I have to think about that. Super funny. Well, I just think it's really funny, like how our kids, like their lingo is. Like
I was gonna say
the
it.
lingo,
Bet.
just the other day, I was calling our son Miles on the phone, and he was with all of his buddies, and the way, like, he's still like, I love you, Mom. what are you doing? Like, he's very caring and he
Not to
talks
me.
with love. But the way that they're talking to each other, I feel like it's a foreign language.
It's a
Like, I
different
don't even know what they're
world.
saying.
No cap.
Yeah. So I'm like, Miles, I remember I just started laughing on the phone. I'm like, what are you saying? He's like,
Yeah.
oh, Mom, you're older. You're just not going to get it.
Yeah.
I'm like, okay, I'm
Yeah.
still a spring chick, but.
Yeah. Or the
What if-
fun. So, well, I was gonna. That's funny because I was gonna say literally the exact same thing.
Really?
Because our kids crack us up, and they try to keep. I try to keep up with them and be young with the lingo.
Yeah.
So I'll be like, no cap, and he's like, Dad, that's not. And I try to get. He's kind of a big sneakerhead, our second son, and he loves sneakers. So I'll try to get these like whatever Nikes, Off Whites, and I'll show him, and then he'll be like, Dad, that's mid. I'm like, mid. Like,
Oh, yeah. He
you
just
know,
said that
like,
about your green shoes.
yeah, and I'm like, no, that's fire. He goes, Dad, no one says fire anymore. It's lit.
How do
They're
they
not
know
lit.
when the lingo changes? I
It
just don't
changes
get it.
faster than my whatever.
But you know, I also just yesterday we were at Target, you, me, and our kids, and we stopped at Starbucks. And when Malachi went and he was like trying to give you your
boy.
drink. And our kids are all about making sure that like everything looks, especially when they're going in public, like everything needs to be like clean and put together. Their hair, the boys take forever on their hair.
Yes.
Like, I'm like, we're just going to the store. So Malachi is giving my husband his drink and he goes like, boop, and slams it down. And the coffee or the Frappuccino comes spraying up all on his hair. It looked like literally a bird just pooped on him.
And it got on my clothes too. Unfortunately, not on my kicks. And I was about to say that's what you get, but I didn't.
Oh my goodness.
Because it was
Well,
so
I was
funny.
sitting off to the side, so I thought it was funny to
hilarious.
watch.
Our kids keep us just
They do.
humorous and
They
alive.
do. I love it.
Yeah. Well, time flew by, and it's about that time to
I had a great time.
a superb time.
You know, I think it's very important that we talk about the recovery and we just break this up into different, segments because
Right.
a lot of times people are a little nervous to actually ask the questions.
Right. Thank you for joining us on Beauty and the Blade. Please follow us at faceandbody.com, faceletterandbody.com, as well as IG at Face and Body Plastic Surgery, and call us at 1-888-900-9065, 1-888-900-9065.
We had a blast discussing all of these topics with you guys, and we can't wait to be here again next week with you on Sunday mornings at 7:30 on Go Country 105. Beauty and the Blade, where beauty begins.
Oh, I want a beauty that will give me that glow. The kind of body that'll make them say, whoa. Get it right with the knife who slays. Beauty and the blade. Yeah, get it right with the knife who slays. Beauty and the blade. Get it right with the knife who slays. Face and body.